Welcome back to another episode of the Blessing Health System podcast. Today we have Shannon Zanger with us from our OBGYN unit. Shannon, thanks for coming on today. I really appreciate it.
Yeah, absolutely. Thanks for having me.
So we could start with just a little bit of your background. What kind of drew you to this career and how did you get your start?
Yeah, I have always wanted to be a nurse since I was about 5 years old. I'm one of those weird people that knew very early on what I wanted to do. I have been an RN now for over 20 years, and I have most of my education and my work has been in women's health, specifically labor and delivery. I'm trained as a labor nurse. And then last year I took a position as the Women's and Children's Care Coordinator, trying to sort of bridge the gap between the inpatient outpatient world and then subsequently help get more people and more access to care.
So what has been the biggest jump for you coming from that RN background into more care coordination?
Yeah, a lot of things, actually. I was nervous to switch roles. I really liked the bedside, and I had really good connections with my patients inpatient, and I was worried about losing that. But it's nice to be able to see the follow-up, what happens to your patient after they leave, and that you get to continue caring for them and follow up with what their interests are in general. You kind of get a picture of the family as a whole rather than just the individual.
When we talk about going from inpatient to outpatient, what is your advice for like brand new parents, like that first ride home to that first night of probably no sleep? What do you what's some advice you give to them?
Yeah, wow, that's a loaded question because there are a lot of things. I think for the most part, though, in general, be kind to yourself. Give yourself grace. This is a new normal for you. It's a new normal for your family. It's going to take some adjustment time, and no one knows exactly what they're doing when they leave. And that's kind of why we want to be a support for that particular time in your life, because it'd be a very difficult transition.
Is there preparation before you're a parent to like, okay, we need to get in the right space? And how do you get into that space?
Yeah, I mean, we'd all love to be totally prepared for every situation in life, right? I feel like particularly having a newborn is one of those things where you can plan and prepare as much as you possibly can, and it will not in one way or another turn out the way that you anticipated it to happen in the first place. Do I think that preparation is important? Sure. I think that it can be very helpful. It can ease some anxiety, specifically if you talk to someone like myself, a care coordinator, somebody who can help you sort of manage those realistic expectations versus what you get on social media and a lot of parents, comparing themselves to others before the child even gets here. But I also think that you can walk in off the street and not have anything packed or prepared, and we're going to take care of you here and make sure that you have those supports in place whenever you do go home for that transition time.
Yeah, I remember when we had our daughter, so we had a nice support group of like my wife's parents. So and without having them, I don't know how we would have, because it's like we would get up with her in the middle of the night, but then it's like the next day you're just so exhausted, like you need a nap. So when you talk about having that support group around you, what are some, like who should you be looking for maybe if you don't have that immediate family that's there?
Yeah, absolutely. That's support is 90% of the game, honestly. And if you don't have immediate supports of family here, that's why we have sort of cultivated our postpartum support group and our breastfeeding support group into one, and it's called Baby Steps. And we really like to put those two groups together and take away the labels of breastfeeding and postpartum because the general public has certain ideas about what those words mean. And in all honesty, when you come to our group, it doesn't matter to us how you're going to feed your baby. It doesn't matter to us what kind of support you have at home. We can be that sort of outside support person for you. And as wonderful as it is for Tina and I, my colleague, to facilitate that group, it really is the combination of the people that come in, the families that come in and support one another. We just get to be lucky enough to watch that support grow, and it's been a really interesting ride so far.
So this Baby Steps group is so it's like a group of like new moms and like some experienced moms and kind of questions and answers and that sort of thing.
That's definitely what it is. And we've even opened it up to pregnant moms who haven't delivered yet, because there are lots of questions about, what is my best tactic for labor and delivery? What things am I going to want whenever I go in there? What does labor actually look like? And so I can facilitate some of those conversations early on. Maybe you have a gestational diabetes diagnosis and you're feeling the typical feeling with that is guilt, like you've done something wrong. And we can sort of steer those questions and those conversations to what's actually going on physically inside the body, and make people feel a little bit more empowered, a little bit more in control of their situation.
So when we talk about the internal support that we have, do you have any like tips of, okay, when you go home, this is kind of what you expect, and then like mom and dad kind of splitting up how they manage things? Is that case by case? Like what is kind of your advice for new parents?
It's absolutely case by case, and not everyone has the mom and dad scenario. So, if you have any sort of support person at all who can be available to you, certainly ask specific things. I need you to come over on Tuesday night and stay with the baby so that I can sleep for, 3 or 4 hours at a time. Sleep is extremely important, and I don't think that we give it the credit that it deserves, especially in that postpartum period. And interestingly enough, 1 in 5 women is at risk for postpartum depression, but 1 in 10 men is at risk for postpartum depression as well. And that's why we really want to look at the whole family and the whole support system, because sometimes, it's going to be difficult for the one who, the parent, the father, who feels like he needs to be the support for the person, but he also doesn't have anyone to go to and talk to. And so we have several fathers that come into our group as well, and they can interact with one another. It's been a really nice addition.
So how do you define postpartum?
So postpartum in general simply means the period of time after having a baby, and that can be up to a year after someone has delivered. I think the common misconception is that the word postpartum automatically means depression, and that's not the case at all. A lot of people, a very high percentage, somewhere between 60 and 80% of women have what we call the baby blues, and that lasts about anywhere from 2 days to 2 weeks after delivery. It's a common feeling among people who have delivered babies. It's sort of like a roller coaster kind of emotional feeling. And then anything beyond that 2 weeks, we really start looking into maybe some postpartum depression and postpartum anxiety, which I actually see quite a bit more than the depression.
I'm guessing that comes from just that huge life change as well as like a huge part of it. And then it's that overwhelming responsibility of this new like life that you're taking care of, plus not getting a lot of sleep. So that is just all of that combined is kind of like your postpartum. Is that accurate?
Yes, you definitely have children because you nailed it. It is a physical, emotional, and even spiritual response during that whole perinatal period. And the perinatal period is from conception until about a year after delivery. It takes some time to get into a groove, get into a routine, and all the while, if you were the person that delivered the baby, there's a lot of hormone shifts going on as well. And it's your response to those hormones that are important as far as whether or not we go as far as to give a diagnosis, which isn't always necessary, or we just need validating support. This is a common thing. You're not alone. We've gone before you and done this. There will be people that go before you after this. And there was a time before that you felt okay. There will be a time after. And sometimes just that statement in and of itself can be super helpful to a new parent.
Yeah, because it's almost like, just out of my experience, sometimes you just feel like off and you don't know what it is exactly. And then as a guy, I don't think about postpartum even being an option.
For sure.
So like that, I feel like that could kind of go into it. So you said it's 1 in 5 women, 1 in 10 men.
Absolutely, yes. Yeah, which is a surprising statistic even for myself, and I've been in this line of work for over 20 years. So I think it's important that we bring that to light, that the support person is really important for the person who delivered the baby, but we also have to bring that support person into our group and help them to understand how to be a support, and that sometimes, they don't have to be excited all the time about being the support person, because it can be a really difficult and daunting task for sure.
So when we look at the healthcare side of it, what are your kind of checkups, I guess you could say, after giving birth? What does that timeline kind of look like?
Yeah, so it's recommended that all delivered women are seen at least at the 6-week postpartum mark. Ideally, for mental health reasons, we would want to see them in the 2-week period. And that's kind of where my role has come in. It's easier for me to get a closer check on those people and keep follow up with them from a mental health standpoint. I also follow people with high blood pressure and diabetes in pregnancy. And the common misconception with high blood pressure is that once the baby is out, that we don't have that problem anymore. And that's not accurate. In fact, people that have no issues with blood pressure during pregnancy are also at risk for high blood pressure 6 weeks postpartum. So we have to make sure that people know what things to look for, what things are you need to get to the ER, serious issues, and then what things can be called into your physician or even your care coordinator just to sort of check in and get an idea of whether or not that's something that needs follow-up right away.
Yeah, I think that's important. Also, you mentioned the comparison game of like, okay, when you get these checkups, like we're gonna let you know, hey, you're doing okay, and is that kind of how you recommend combating that? Is to like talk to people, talk to professionals? How do you recommend avoiding comparing yourself to all these moms that you see on social media, which it's not real, you know? So like they have their struggles too, but you just see that and you think, oh, I should be doing better.
Yes, absolutely. I mean, we all know that social media usually gives us the picture perfect arena. And, you know, anybody that knows me personally or knows me well knows that I'm very honest and straightforward. And I speak a lot to how, yes, we know it's easy to know that babies are beautiful and wonderful and that they change your life in great ways. But I am the first person typically to tell them it also can be one of the most awful parts of your life. And I don't mean that to scare people away, but it's okay that you don't love every second, that you don't cherish every burp and cry and drool. It's okay that you need a break sometimes. It's okay to step away. And making those comparisons can be really damaging. You know, one of the things I tell moms repeatedly, and dads too, is that you don't have to put on a brave face. Specifically at the Baby Steps group, always with me, you never have to put on a brave face, and there is such strength in vulnerability. I have seen some incredibly strong women come in and say, today is not a good day and I need help. I am having these thoughts and it's scaring me, and where do we go from here? And it's actually a much more common scenario than you might think.
Yeah, I mean, you can't grow if you don't tear up the soil first. Absolutely. Right? Yes. So getting down to what's the cause of it and then acknowledging that it's possibly is something to do with postpartum. I mean, is that one of the things that, like, let's say you see a postpartum woman a couple weeks after birth and then she's like, yeah, my husband or whatever their situation hasn't been acting himself. Is that kind of your first thought of like, hey, maybe it's a postpartum problem that we're dealing with?
Yes, so definitely now. And I'll be totally honest, it wasn't until this year when I had further education on perinatal mental health. It's become something that I'm very passionate about. And I would have done what the rest of society does and kind of ignored that postpartum support person. And now I really try to bring them into the fold. And I'm hoping that as we get more information out about this group, that more support people start coming. Sometimes mothers come with their new grandchildren and the mother of the baby, and then sometimes dads. We actually have several dads that come relatively regularly. And even if they're not interested in talking quite as much as the other moms are, they're hearing and they're listening to, you know, everyone in here is having sleep issues, or, you know, maybe we went through a time where sleep was difficult and now it's better. And so they can sort of see the light at the end of the tunnel. But that support for that birthing person has really been a key part in helping somebody through that postpartum period. And then them working together as a unit has certainly been a positive and very powerful thing.
So do you host these groups, and are you like the main kind of overseer of it all?
Yes, myself, and equally as important, in fact, I would argue probably more important in these groups is my coworker, Tina. She is an RN, has been a nurse for over 30 years. She is our internationally board certified lactation consultant. The other great thing about Tina is she has her own children, her own grandchildren, and she has been a pediatrics nurse for years and years. So there's a lot of feeding talk. We talk about bottle feeding. We talk about breastfeeding. We do weighted feeds on babies every time they come in, just so that parents can see that their babies are growing and thriving in the way that they need. But Tina's also a car seat, certified car seat technician. And so we have people that bring in car seats and we check those out for them. Or, my baby has this rash this month. What do you think is the most important thing for us to do? So we have a lot of topics that we bring together, and having the two of us be able to play off of one another. She sort of focuses on the peds part and I focus on more of the adult part. And then we overlap a lot, being able to catch those things. Maybe I had a conversation with one of the parents that she was not around for, and so I'll fill her in. I think you need to follow up with this person. And then we also know when one of our personalities is better for a patient than another, and so we'll put that person in front of them. It's a very symbiotic relationship. I'm super grateful to have her with me, and but the most incredible part of it is watching the parents in the group lift one another up. They may go to dinner, later that week together, or meet each other for lunch, or just, sometimes we have parents who really want breast milk and they're not producing, and so another one will donate their own breast milk to that baby. We've had that happen several times. And we'd love to take credit for all the wonderful things that happen there, but we honestly just feel super honored to be able to facilitate this kind of situation for these new parents, because we're the ones that are getting the honor and the privilege of watching these parents go through, a very scary time at the beginning, and then you can see them sort of learn and start to shift into the veterans, and they welcome in the new people, and they start sharing their experiences and what information they think is the most important, whether it's products for baby or, what method they're using for sleep training. And it's just a really positive and help-focused, centered environment.
And so what are the ages of the children usually? Does it go up to whenever they feel they're ready to kind of move into like a different group, or they feel like they've got the hang of it, or how does it work?
Sure. We actually like to have babies of all ages. So we certainly have a lot of the very new, specifically, parents go home on a Friday and they haven't slept for the whole weekend. And then so we like that Monday morning from 9 to 11 group, because we can sort of catch those people that were in the hospital over the weekend. And so, that's the very new sort of like no sleep experience for those people. But then we also have parents there who have toddlers who are walking around and who are no longer breastfeeding, no longer on formula. They're eating table food, but those new parents can pull information from those other parents. And it's good for the parents of the older children to come in, because we sort of forget that the mental load is still very significant as the child grows. And we really need to be paying attention to those parents with 6, 7, 8, 9, 10, 12-month-old infants, because postpartum depression can happen up to 18 months after delivery. And for some people, it's very much an older baby situation. And so it's nice to be able to have them be able to come back and see that, they're giving something that can be helpful for their own mental health. And then, again, just watching the babies interact and grow. I think that's one of the things that most of the people like, is we get to see the changes in the infants from week to week. And then for the whole year following that. And each side can get something from the other. I think that's the most important part.
Awesome. Well, thank you, Shannon. I had a good time and definitely learned a lot about the support group.
Sure. Yeah. Thank you very much. We are so excited to have people, and certainly grateful to Quincy Public Library for being so kind and letting us come in there. It's a very large venue. We have plenty of room, and we welcome all pregnant and recently delivered people to come in, and let's get you the support that you need.